Hello everyone and welcome to the third Leadership Podcast. This session is part of NHS Lanarkshire's Realistic Medicine Communications Plan, and it's supported by a project grant from the Realistic Medicine Unit of the Chief Medical Officer. As part of Quality Week 2021, for this podcast we are focusing on staff wellbeing, using questions from staff from across NHS Lanarkshire and the Health and Social Care Partnerships. I'm Bob Smith from the NHS Lanarkshire Communications team, and today I'm joined by our expert panel, who are Eddie Doherty, Executive Director for Nurses, Midwives and Allied Health Professions, Paul Graham, who's Head of Spiritual Care and Wellbeing, Lillian Macer, Employee Director, Dr. Sue Ross, Consultant Clinical Psychologist and the lead for the Specialist Staff Wellbeing Psychology Service, and Kay Sandilands, who is our Director of Human Resources. So thanks to everyone who's submitted questions for our panel to answer today. I'll direct the questions to the panel and each of them will contribute to the discussion as appropriate. So question number one is, how will NHS Lanarkshire ensure that staff are still supported as patient numbers return to pre-COVID levels? What assurances are there that the staff who are struggling will continue to have access to assistance and be encouraged to discuss issues and difficulties? And if I could ask Paul maybe to start us off with a response to that one.
Thanks, Bob. I would probably start by saying what everyone has been through this year has been just so different than what we've experienced before. And the fact is we've come through it. And to me, that's a great credit to everyone and to the teamwork across the piece. I'd say that we've put in place a couple of mechanisms to provide support. And all the different mechanisms across the different services, they act like strands of a safety net underneath the teams so that we can be there for folk. We've got a 24-hour helpline that people can contact. That's there for all staff, 24 hours, 7 days a week. So that's covered by the staff care team. You'll get someone at any time of day you call with that. We've got wellbeing centres in the acute sites. We've got rest areas in the community sites. And we've even got rest areas into the vaccination centres that we've put up as well. And they've been provided with tea, coffee, snacks, water, etc. in there. So that I feel as if this is a lot of the basics that we want to put in there for staff that's in there. The board has committed funding to the staff care team that will see us through till next year. So that this is an ongoing commitment from the board. We've got a team that was spent 7-8 weeks training, and they were let loose last week and have been working one-to-ones. They've been working at providing group work with folk. They provide mindfulness sessions for teams. And we've taken an approach of aligning them to, we've got someone that's a number of days working in North Partnership, a number in the South Partnership. We're looking at supporting medics. We're looking at how we support people working from home, because that's quite a new and novel setting and can be quite stressful and isolating for people. So we're looking at that. We're also looking at how we support team leaders throughout this time. So there's a kind of array of different support measures there. The other probably the most important part of this is we've got a strategy group that has got, so we've got members of the strategy on this panel with us here. It's been chaired by Eddie and Lillian, and that's looking at the health and wellbeing of Lanarkshire, staff in Lanarkshire across health and social care, so that we've got a joined up approach to this, and we really are putting staff at the centre of what we're planning.
That's great. Thanks, Paul. Is there anyone else in the panel wants to come in? Yeah, Kay, I see your hands up.
Thanks, Bob. It's probably just to add that obviously in addition to that, we still have all our existing services that have been there for some time from occupational health and safety. So our staff services that are provided there. So there's ongoing risk assessment, there's the management referral schemes, support for staff for physiotherapy, etc. So again, those services continue to be available for all staff going forward.
Lillian, would you like to add something?
Yeah, thanks very much. I think just to add to Paul and Kay, and also just to recognise the huge effort that all our staff have done over the last 14 months. I think we have an incredible workforce that have gone the extra mile, and it is hugely important, and this question is really important, that we offer that support and we demonstrate that support is there. And I think Kay and Paul have articulated the board around occupational health, around staff care. We should also recognise the work that the staff side organisations through the trade unions and professional organisations can offer to staff. So we have a holistic approach to this. But I would also say that those staff working in our acute sites, in those PFI sites, Serco staff and ISS staff, that commitment to that support is there equally in the community through our care home staff. That commitment to support is also there. So we have a wide ranging support that's offered out to all our staff, irrespective of your employer and where you work. Thanks, Bob.
Thanks, Lillian. And Sue, would you like to come in?
Yeah, thanks, Bob. Just to add to that, we are very soon to launch a new specialist service within psychology, which is Psychological Services Staff Support Team, that we've been just designing and setting up over the last few months. We're soon to launch in the next few weeks. There'll be more information about how to access that service. So it is going to be not so much on the wellbeing side, but when staff have mental health needs. We are offering a service to any member of health and social care staff in Lanarkshire who either live or work in Lanarkshire, regardless of employer. So for colleagues within NHS, both local authority, health and social care partnerships, and also the independent and third sector. And it's a self-referral option or line management, Salus, staff care and wellbeing, NHS 24. So there's a range of ways to actually come into that service and have that specialist mental health assessment, and then together think about what treatment options are best fitting the needs of our staff members. So there will be more communicated about that in the coming weeks and how to access that service.
Okay, thanks everyone for your responses to that one. We'll move on to the next question, which is, how does NHS Lanarkshire intend to support the wellbeing of staff members who are carers, as restrictions for most people ease? Is there a system in place that allows individual cases to be looked at as discussions start about returning to the office? And I think, Kay, can we come to you first to respond to that?
Thanks, Bob. Yeah, I think again we recognise that obviously we have had a significant number of our workforce who haven't been in the workplace for some time, and that coming back into the work environment might be a bit daunting for them. There have been changes which are all for their benefit around infection control and management to support staff, but really we appreciate that can be quite difficult in the initial stages coming back to work. We have issued guidance for managers, and that's to support individual staff, and really those discussions with staff as asked should be happening before they actually come back into the workplace, with the offer of taking them through an individual risk assessment with their manager. And in certain circumstances that may require, if there's some more complex needs, that they have a referral to occupational health as well. So we hope that we have quite a supportive mechanism to bring staff back into the workplace. That's
great. I don't see any other hands up on that question, so I'll move on to question 3, which is, how do the panel foresee future work patterns? For example, could staff continue to work from home? Will there be opportunities for working from home roles in the future? And I think, Kay, if we could come to you again in the first instance to respond to that.
Thanks, Bob. Again, I mean, there was phenomenal change over a year ago when the pandemic hit, and the speed at which we responded and staff moved to home working was phenomenal. And the flexibility that staff showed at that point has to really be acknowledged. The question is really about whether we're looking to see home working continuing going forward. However, I realise that we won't have all the answers on that today, but what I can say is that there is a recognition that this has been useful to us, and that we will be looking to see how we can utilise home working to an extent going forward. But I think it's fair to say that not one size fits all. There's definitely some opportunities in certain roles for continuation of home working, and it will definitely appeal to certain members of staff, but not everyone. So I think we've got to look at this both from the role perspective and from the individual perspective. At the moment, we are undertaking some local scoping, and this is to look at some of our corporate services. And we're looking firstly at how that role has been managed during the period of the pandemic. What do we see as the future potential for that role as far as the base is concerned, and what are the individual staff preferences for that role? And from that, we'll be able to gain a bit of intelligence that will allow us to plan for the future on that basis. In tandem with that, though, there is national work going on to look at home working, and there's a national Once for Scotland policy that's being developed. That's due to be out for consultation between June and July this year, and we'll be very much encouraging from an HR perspective that we engage staff's views in that consultation and make sure that we influence the final policy outcome.
Okay, that's great. Sounds like there's a lot of work going on there. Fine. Paul's put his hand up, so if he could come to you.
Thanks, Bob. I'm aware of the fact that it's Mental Health Awareness Week this week as well, and the impact of working at home on people is taking its toll as well, and it's something I think that we just have to be mindful of, and probably take a wee bit more care of ourselves when we are working from home, because there's only so many Teams meetings you can actually survive in a day as well. And I think it's important to take regular breaks around about that, and just be kind to yourself, because we would normally interact with folk going to meetings or before a meeting, and sometimes that doesn't happen in a Teams environment, although we're trying to change that way that we approach Teams meetings. I'm just aware of those different stressors that are on people when they are working from home, and I'm especially supportive, and we've got different areas that we're trying to provide information for people about how to manage those things.
Great, thanks, Paul. Lillian, did you want to add something?
Just very quickly, Bob, if I could, and it's just maybe to add on the points that Kay raises. We are doing huge amounts of work in this space, both at a local level and at a national level. I think it's important for colleagues and staff who are currently working from home and maybe thinking about how is this going to shape up. The thinking nationally and indeed within the board is that there potentially will be a more blended approach, a more flexible approach to how people work. And I know people will be nervous, will be concerned potentially about their own circumstances. So again, it's important to have those conversations with your manager, with your trade union rep, to make sure that your concerns or fears are being talked through, and that your issues are being raised, and that you come to some solutions around that. Because for us, it's important for your well-being that you get the opportunity to raise any of those concerns and have those conversations. So encourage people to keep talking about it, encourage them to talk to their managers, talk to their trade union reps, and encourage them to keep a watchful eye on what's coming out from both national and local.
That's great, thanks a lot. Let's move on then to question number 4, which is how will you support the growth of a symbiotic, mutually beneficial relationship between primary and secondary care, and discourage any feeling of being battled with rather than working in conjunction? Eddie, could I come to you to respond to that first?
Thanks, Bob. And that is a great question. One of the things that I think has shone through very clearly over the last year and a half has been what we can do when we work together. And there's been some really strong evidence of how that interface between primary and secondary care, private care, all of those groups who are effectively the stakeholders for supporting patients and clients can actually do. So I think if we harness that will, which is clearly there, and look forward to how we can wrap this around our patients, rather than looking at any potential friction points in the system, I have an absolute faith that we can make really significant leaps and bounds in this particular area. There are lots more opportunities than there are kind of struggles within this, I think, and I'm really keen to exploit and work with our colleagues in all areas, not just primary into secondary care. So I think the opportunities are ours to take. I hope that's a reasonable answer.
Thanks, Eddie. And we'll move on. OK wants to come in on that as well.
Yeah, it was just to say, I think we have demonstrated amazing collaborative working during the period of COVID, and I hope that we can build on those relationships that we've developed going forward as well. So really just to echo what Eddie was saying.
Thanks, Kay. So we'll go to the fifth and final question. And it is, how can everyone feel valued in recovery? And how do we create an inclusive culture within the organisation? And I think I'll come to Sue first for a response to that one.
Thanks, Bob. I think that's a really great question and a really lovely way to finish up our conversation today. We've talked about, I've mentioned the mental health support that's available for staff, and Paul and Kay really highlighted some of the wellbeing supports that are there. But the foundation of staff wellbeing is in the prevention of work stress and wellbeing difficulties actually arising. And the strongest thing that we can do around prevention really is having a workforce that feels safe, and that's safe physically, professionally and emotionally, and also having a workforce that feels valued and that they matter as individuals, as well as that their role and their contribution is valued and recognised. Throughout the work I've been doing over the pandemic so far, we've had a lot of engagement with our workforce through formal surveys, through different working groups that have been established, and trying to have an ear to the ground and trying to understand what's getting people through, what's mattering to people, what's helping them thrive at times of adversity. And what we hear time and again is it's that immediate support that people get from their direct colleagues, from their peers, who know what that shift has been like, who know what the strains are, and who can bring in the humour and the banter as well, but also share the hardships and the difficult times that they face together, that camaraderie, and the support from the immediate supervisors, team leaders, and cascading throughout the whole organisation. So to me, that's really where we have to focus our efforts on a workforce feeling valued as we move into recovery. It's all of us valuing each other, and those small conversations we have throughout our working days all make a difference.
Thanks, Sue. Eddie, can I come to you?
Thanks, Bob. And I think most of my points really dovetail very clearly into Susan's position. I think the value we place on the culture and that support for our staff, I think, is eminent with the people around this virtual table, if you like. We're all clearly committed to it and continue to be committed to how we support our staff, our colleagues and our teams to maintain that level of personal and professional safety. And there's lots of things that we're looking to actually put in place to assess that cultural piece. I'm certainly keen that we start some of the testing work on the safety culture tools, which are used in another couple of areas. I found them very, very successful. And because they are about asking the questions to the staff and asking them for that honest level of feedback and answering and working to that, has got to be the way forward. We have said in a number of environments that our staff are our most precious resource. Now's the time absolutely to work together to prove that. And I think the will and the appetite in the organisation is quite clear on that particular field.
Thanks, Eddie. Kay, can I come to you and then Paul?
Thanks, Bob. Again, really supportive of both what Sue and Eddie have already said, but I suppose just the other aspect, just wanted to add that we have included to try and enhance and increase that inclusivity of staff, is that we, even during the pandemic, identified the additional impact COVID was having on our BAME workforce, and we have introduced a BAME staff network in this last year, which has proven to be very successful to allow staff to have an opportunity to express their views. And the model that we've used to develop that, we're hoping now to repeat for other staff groups such as LGBTI and our employees with disability. So again, just looking at different ways to ensure that we are giving the voice of as many of our staff as we can.
Thanks, Kay. Paul, would you like to say something?
Yeah, thanks, Bob. I think it's nobody has been here before. None of us have been here before. There's not a playlist or a playbook for, and not one person in all of our teams has got the answer that we're waiting on, and it's going to be done to us. I think this is something that is really, we've talked about it earlier on about that collaboration, that teamwork. And in Lanarkshire, this is one of the best jobs. In fact, it's the best job I've had, and I'll say that openly to anybody that asks me. Working in the culture in Lanarkshire has been really helped me grow and develop in my role, and I think that at this time that there's an element of kindness we have to show to each other, because we don't know, we're finding our way through this as well. So I would say, if you don't think your voice is being heard, please raise your voice, because it really is what matters to you that's going to get us through this as well.
Thanks a lot, Paul, and to everyone who's contributed. So I think we can say that we've come to the end of a very successful session there. So it's thanks once again to everyone who sent in questions and to our panel for all their contributions today. As always, we're keen to hear your feedback on anything you've heard today. So you can feel free to get in touch with us, share any of your thoughts. And on behalf of myself and the panel, I'll just say thanks a lot for tuning in and watching. Thanks.